you everyone for coming today. I am so excited to do our first live presentation for children's airway health and the things we can do to help prevent some of the illnesses that we're seeing in kids and in adults. So our goal is to do preventive medicine, and if we are not catching this as early as kids are born or even before kids are born, then I think we're really late. So let's take a look at some of the things that we've been doing here at East Philadelphia. We started focusing on airway health a few years ago. Is it echoing? Sorry. Better? Okay. We started focusing on airway health because in 2017 the ADA came up with advice that all dentists should screen for any issues with sleep disturbed breathing. So we want to make sure that we are not screening only, but also once we find these issues in children and adults, that we do something about it. Because it doesn't help if we just say, hey, you have some issues and you have a problem. We want to make sure that we actually present a solution as well. And sleep disordered breathing is causing a whole host of illnesses. It leads to heart disease. It leads, in kids, it leads to ADHD. It leads to bedwetting, behavioral issues, night terrors, night sweats. So we want to make sure that we are addressing these early. A little bit about why I started this journey for our team and our practice over here was because I am a mom of 2 kids, and my son snores a lot. He's being one of those kids that since he was little, he's always struggled with having, tonsils and enlarged and allergies, and he's chronically ill. And I did not know what was going on because I thought I was doing really well, giving him a healthy diet and making sure he was always properly cared for. But one of the things that I didn't recognize, even though I'm a dentist, was that he was not breathing well, and that had affected his skeletal growth and development. And if I had known this earlier, then I would have done something preventatively for him. In his father's family side, they have a family history of all the males having a heart attack by the age of 50. And I don't want my son to be a statistic that is also going to have heart issues. So we want to do prevention for hopefully other kids. And I know we are treating him, but we also want to make sure that we can do this so that other kids don't have to go through what he's going through right now. So our presentation today is going to be also co-hosted with Megan over here. She is our myofunctional therapist and hygienist, and she is going to be doing a presentation of all the stuff that is linked to childhood airway health.
Okay, great, thank you. All right, good evening. I am Megan. Like Dr. Patel said, I am the dental hygienist and myofunctional therapist here at Wisteria Dental Care. And I know some of you that are here, and maybe those of you who are watching at home are struggling with poor sleep. You might hate your CPAP, or your partner complains about your snoring. But I think most of you are here to find solutions for your kids. So as we move through this presentation, you'll see that the causes between what you're struggling with and the things that you're seeing in your kids are the causes the same. Okay, so as we start, my focus is going to be on children. So sleep disordered breathing, like snoring and sleep apnea, are not something that just shows up in middle age. We start seeing it really early on in life. So I'd like you to take a look at this picture of the children here and ask yourself, do they look healthy? Now, I think most of us would say, yeah, they look pretty darn happy and healthy, they're smiling. But I'd like you to pay attention to this little boy down here in the lower right-hand corner in the blue and white stripes. You can see that he has dark circles under his eyes. We call this venous pooling, and this is a sign of chronic poor sleep. You can see the same for the little boy in the upper right-hand corner with the red, white, and blue stripes. He looks a little on the tired side. And now if you focus your attention on the little boy in the green and white and the little boy in the black shirt down in front, you'll notice that they have very gummy smiles, and you can't even see their bottom teeth. So this tells us a lot about how these kids are growing and developing. So lastly, I'd like you to take a look at the little girls down on the lower right, the one in the brightly colored stripes and in the white sweatshirt. And you'll notice that their front teeth are very prominent, almost as if they're too big for their mouth. But the truth is their mouth is not big enough for their teeth. Right, so we have a silent crisis in America. On the left-hand column here, you'll see ailments that we typically see in children. Things like ADHD, bedwetting, mouth breathing. We have frequent nightmares and night terrors, night sweats, crooked and crowded teeth. And now on the right-hand side, you'll see things that we often find in adults. Depression and anxiety, heart disease, hypertension, increased risk for certain types of cancers, Alzheimer's and dementia. So clinicians treating both kids and adults estimate that about 90% of their patients have at least one of these symptoms. But I think it's an understatement. So as a hygienist, I review medical histories with my patients every single day, all day long, and I can tell you that these things usually come in clusters. For adults especially, they might have hypertension, struggle with obesity, and have heart disease. Or we see patients with depression also struggle with anxiety. They usually go hand in hand. So what we find is that people in our country are really struggling, and oftentimes it comes down to just poor quality of sleep, and they're not able to recover properly at night. So just like our kids in the beginning, we're showing some signs and symptoms. The leaves on our tree outline those here. So we see ADHD in our kids, crooked and crowded teeth. We see daytime drowsiness and mouth breathing, difficulty learning, and bedwetting. But we need to find what the underlying cause is. What is actually happening here? And it's a compromised airway. But how did we get this way? What is our root cause? And what I'm going to show you today is that the root cause is really how we developed early on in life. Our upper and lower jaws are very narrow, they're underdeveloped. We have a low-lying tongue posture and weak muscles of the tongue and the face. So where did this come from? I can tell you in a dental office, this is pretty commonplace. We see it all day long. And so oftentimes our kids, they need to be put into braces to make space and to put everything back in its proper position. Maybe even need braces just to make space for their teeth to come in the first place. But where does it come from? So normal growth of the face and the skull, known as craniofacial growth, is really important, and it happens really early in life. So this inner line here on the skull shows growth at about 2 years of age, and the outer line is showing you growth at 17 years. That's 15 years worth of growth. So what I really want you to pay attention to is how most of the growth is happening on the lower 2/3 of the face, from under the eye and down. So we know that at age 2, we're about 55% developed. At age 4, that goes up to 75%. And by the time our kids are age 12, they're somewhere between 90 and 94% developed. Okay? Normal craniofacial growth is wider, downward, and forward. When we have that proper growth, that will allow for proper airway development as well. Okay, so why? Why are so many people suffering from abnormal growth and development? Well, to illustrate this, let's take a look at some research from Dr. Corancini. Dr. Robert Corancini is an anthropologist with extensive research and published articles. So 400 years ago, the human skull was vastly different. Our bones were wider and thicker. Our jaws were big enough to house all 32 of our teeth. But over time, things have changed. And so now most adults, we've had our wisdom teeth removed, and we still don't have enough space for the remaining 28 teeth. So Dr. Corancini studied some isolated rural populations around the world. And what he found was that moms were breastfeeding for many, many years. They had hard, fibrous food diets, and that there was little to no incidence of crooked teeth, and they had perfectly formed jaws. Interestingly, Dr. Corancini found that once Western culture introduced its soft diets into these isolated populations, there was a huge increase in malocclusion, or crooked and crowded teeth. So after the first generation, after introduction of soft diets, 50% of people had malocclusion. After the second generation, 70%. And after the third generation, 85% of people had crooked and crowded teeth or malocclusion. Now we're about 7 generations post-industrialization, and I think that these percentages are much, much higher. I can tell you that most of my patients have some form of malocclusion. So what we can draw from this is that form follows function. A diet that is hard and fibrous works the chewing muscles and the jaws to help develop things wider, forward, and downward. Okay? Soft diets create weak muscle tone and underdeveloped jaws. So what we can learn from Dr. Corancini's research is that malocclusion is acquired. It is not inherited. You do not have crooked teeth because your parents had crooked teeth. And we know that because it takes 27,000 years for a genetic mutation to show up in only 51% of the population. And as we showed you, in 85% of the population, only after the third generation of soft food diets, we had quite a bit of malocclusion. So in Western culture, what do we do differently? What's the problem? We have inadequate breastfeeding, and we do a lot of bottle feeding. And I'm not knocking on anybody. I'm a mom too. I work. I get it. I breastfed my kids for as long as I could, but once I went back to work, they did get bottles. And but what's amazing about breastfeeding is that babies have to bring their tongue up and forward into the roof of the mouth while they're nursing in order to draw milk from mom. When we bottle feed, the exact opposite thing happens to the tongue. It drops low and backwards into the airway, almost as if that increased flow from the bottle is too much for the baby. They're trying to protect their airway. Okay? Once we transition them to solids, really what we're giving them is yogurt melts, puffs, pureed and mashed up food, things that they just have to suck and swallow. There's no chewing involved, which means that their muscles stay weak and there's limited development to their jaws. So as I showed you, malocclusion is acquired, not inherited. It's unique to Western cultures. And if we have malocclusion, it's a key indicator that we may have an underdeveloped airway. All right, so let's check out Dr. Wallace. Dr. Wallace was a dentist in the early 1900s, and what he says is that early soft diets prevent the development of tongue muscles. With the tongue being underdeveloped, it cannot influence the placement of the baby teeth within the jaws, which leads to then the baby teeth are crowded. If baby teeth are crowded, there's no space for adult teeth to come in. Okay, so Dr. Wallace told us that the tongue, if in its proper place, acts as a scaffold for the upper jaw. When the tongue is up and forward, it applies constant gentle pressure to the backs of the teeth, creating a beautifully rounded arch with perfectly placed teeth. Now, if we take a look at these two pictures, the top one here, you can see a lot of crowding with the teeth. You can see that the arch itself is very narrow and close together, and that the palate itself is vaulted upwards. I can tell that this patient's tongue never gets to the roof of the mouth. Even if it were to go there, I don't think it would fit. But then on the bottom picture, you can see a really nice rounded arch, the teeth are in proper place, and you can almost picture how the tongue fits up into the palate. All right, so let's talk about that upper jaw, the maxilla. It's a really important bone. And it's important because it forms your midface. You can see highlighted in orange here, it's much, much more than just housing your teeth. It forms the underside of the orbit of the eye, part of your cheekbone, around the nasal cavity, and then of course houses those upper teeth. But Dr. Galimino from Stanford University did some research that suggested that expanding the dental arches in patients who aren't breathing well, who have sleep disordered breathing, and they also have upper and lower jaw constriction, expanding those arches can be really helpful. All right, so let's take a look at our airway, how these things are tied together. So our airway consists of, consists of the nasal cavity, the nasopharynx, oropharynx, and laryngopharynx. We're going to focus for a moment just on this upper airway here. What I want to show you is this is in cross section, but this is the upper jaw, the maxilla. Okay? And you can see that it is the roof of the mouth, but it's also the floor of the nose. And so, when your upper jaw is too narrow and it's vaulted up, like in that Gothic arch photo that I showed you, it actually vaults up into the nasal cavity. This reduces airflow and increases your risk for developing things like deviated septum. The other concern is that if your tongue is low-lying, not in its proper position up and forward, when you go to sleep at night, it's lax. Your muscles are relaxed, you're laying down, and there's nothing preventing that tongue, if it's not suctioned to the roof of your mouth, from dropping back into the oropharynx and blocking your airway. This is when we start seeing snoring and sleep apnea. So, a narrow arch means no room for the tongue. We need it up and forward to keep the airway open while sleeping. So what does your airway look like? Is it a narrow straw or is it a garden hose? I hope it's a garden hose, but I know for most of us that's truly not the case. All right, so these images are from some special x-rays called CBCTs. And they've outlined here in all these colors the size and shape of these patients' airways. So we have a patient who has severely constricted lower airway, a typical mouth breather, a child with Asperger's syndrome, and an adult with sleep apnea. But what I'd like you to take a look at is how much red is present in these pictures. Red is bad. Red means that there's not proper airflow for these patients. So next, I'm going to show you a video by right2grow.org. They're not affiliated with our practice, but their video really sums up what we've been talking about so far. So let's take a look.
Just a few hundred years ago, the human face was different. It was forward grown. Her wide profile and large dental arches ensured straight teeth and room for her tongue. Most importantly, she had plenty of space behind her upper jaw so she could breathe through her nose with ease. The modern face has changed. From childhood, her dental arches are less developed, crowding her teeth and giving her less space for her tongue, which impacts her airway. Many believe this stems from a number of causes, such as allergies that affect breathing. Another is the poor nutrition and softness of modern diets, causing toddlers to have underdeveloped chewing muscles and smaller dental arches. Because her upper jaw is too far back, she will struggle to breathe normally through her nose. To get more oxygen, she will compensate by opening her mouth to breathe, bringing her lower jaw down and back, creating a downswing of the face. This is how her undergrown upper jaw creates the appearance of buck teeth. She's actually compensating in order to breathe. If not corrected, the problem carries into adulthood. Extractions were documented in the 1600s as a way to treat crowding. Although they are a quick fix, they don't treat the problem of underdeveloped arches and have been implicated in harming the facial profile, making them the subject of much debate even today. In order to breathe, she will slouch her head forward to prop open her airway, creating a lifetime of neck and back pain. This is the infamous forward head posture. Having a healthy airway is crucial to the survival of life, and especially so during sleep. When muscles around the throat relax during sleep, a healthy airway stays open because the tongue is sitting forward and has enough space to be suctioned up against the fully grown palate. With underdeveloped jaws and dental arches, the palate is too small for the fully grown tongue, which is sitting back to begin with. When she sleeps, her tongue does not suction, rather it falls back and cuts off her airway. This is obstructive sleep apnea. Like crooked teeth, it's a modern condition. However, it can reduce life expectancy. Not surprisingly, obstructive sleep apnea is marked by the same traits that describe the headgear effect. Both jaws are grown down and back, creating a clockwise rotation in the lower third of the face. Essential to this is nutrition, the use of chewing muscles early on in life, and good breathing habits. This means breathing through the nose with the mouth closed and the tongue resting up against the palate. Also, the practice of maxillary expansion has been shown for over a century to correct crooked teeth and improve nasal breathing space. And since 1918, orofacial exercises have been shown to correct mouth breathing habits.
Okay. So next I'm going to show you a clip of baby Eli. And baby Eli is in the backseat of his car. His mom is in the front taking a video of him and narrating what she's seeing. Now baby Eli is having a sleep apnea event. He is not breathing well. You'll hear him gasping, choking for air. And some of the episodes are quite long. So let's take a little listen here.
That was all. Still holding it. He's trying to take in air. There he goes. Watch. He's holding it. He's holding it. He's holding it. He's holding it. Still holding his breath. He's going to gulp again. There he goes. Opens it again. Again. He's holding. He's trying. There he goes. So it's been 3 minutes and 15 seconds. You can see how many episodes he's had of not getting calm breaths in. Now watch what happens when I take his jaw and I just bring it forward. If I can. See if I can. Just bring his airway forward. Listen to the light breathing. There we go. Now he's breathing through his nose.
So you can see the photo of baby Eli. His mouth is open, he's mouth breathing, and his jaw, just like in the Right to Grow video, they showed you how it is down and backwards. And so you can imagine where his tongue is. It's in the floor of his mouth. And at this posture, it's also in his airway. That's what he's choking on, right? Well, some of these apnea events are long. Like as I counted, they were like 12 seconds. And now when you are having sleep apnea, your heart rate increases, your blood pressure increases. And it takes quite a toll on your body over time. But as you can imagine, for children, the lack of oxygenation to their brain and body takes a serious toll. Okay. So nasal breathing. You heard baby Eli's mom mention that when she brought his lower jaw forward to open his airway, the breathing got silent. And that's exactly what it should be. We should be breathing through our nose, and it should be silent and invisible. It should be easy, right? Nasal breathing is really what humans are meant to do. We are born as obligate nasal breathers. Over time, we develop bad habits or nasal obstructions that then cause us to mouth breathe. So what do we know about nasal breathing? Breathing through your nose helps to filter out dust and allergens, boost your oxygen uptake, and humidifies the air you breathe. The benefits of nasal breathing, you lower your risk of snoring and sleep apnea. You reduce your exposure to foreign substances, support the correct formation of your dental arches, your upper and lower jaw, and the placement of the teeth in them. You lower your risk of allergies and aid your immune system. Okay, So now let's take a look at some research by Dr. Linder Aronson. He completed an observational study of children who were mouth breathers and children who were nasal breathers. And he observed them in their natural environments. But what he concluded was that mouth breathing children develop differently. Mouth breathing, nasal obstructions, low tongue posture all result in higher rates of malocclusion. We saw more crooked and crowded teeth in the kids who were mouth breathing. The problem with this is that the more malocclusion that is present, the more you're breathing through your mouth. Your tongue can't fit up into the palate. So now we're dealing with more and more downstream effects as the child continues to develop poorly. So we want to promote natural nasal breathing. This is a pillar of health that we try to achieve here in our office with both kids and adults. All right, ADD. There is a connection between attention deficit disorder and the poor quality of sleep that our kids are experiencing. If they're not breathing well, they're not getting proper restorative sleep, and it can result in the symptoms you see with ADD and ADHD. So here's a video from Dr. Ben Moralia to tell us more.
We learned a lot about behavioral issues from a researcher, Dr. Karen Bonnick. Dr. Karen Bonnick did research to show that there was a correlation between sleep disorder breathing and behavioral issues in children the next day. And what we mean by sleep disorder breathing is really anything other than silent and invisible nose breathing. So the parent who recognizes that their child is sleeping and their mouth is closed and they're breathing through their nose and that breathing is silent and invisible, that would be a really good form of breathing for getting an excellent quality night's sleep. That pathway leads to refreshing, rejuvenated sleep that the child would wake up, ready to tackle the next day in a format where their behavior would be excellent and they would be attentive to all the details they needed to do at school. But the child who mouth breathes or worse, because the sleep disorder breathing category basically is everything other than silent invisible nasal breathing. So when you are mouth breathing or worse, which would be snoring or even apnea type episodes, mouth breathing or worse, that disrupts the quality of the sleep. So with mouth breathing going on or worse, that child has a disrupted quality of sleep. And in the fancy words, we say sleep fragmentation. But for lay terms, we think about sleep deprivation. And so mouth breathing or worse disrupts the sleeping pattern, which disrupts that restful, rejuvenated technique that should be happening to set you for the next day. So basically you wake up, even if you slept the right number of hours, it's not a quality night's sleep thanks to the breathing. But now without that good quality sleep, it's as if you were sleep deprived, and waking up sleep deprived does have a relationship to your behavior the next day. Dr. Karen Bonnick showed that the children who have sleep disorder breathing were 50% more likely to be diagnosed with ADHD.
Okay, so here's a published study that was evaluating the use of a monoblock appliance, which is the guide appliances that we use here for kids in our office, for children ages 5 to 12 with ADHD symptoms. Now, the duration of the study was only about 7 months, and 61% of kids using the guide appliance showed an improvement in their symptoms. Okay, so next we have bedwetting. Bedwetting is another common problem with children that are not sleeping well or getting proper oxygen during sleep. And it's something that parents are often reluctant to talk to us about. It's embarrassing for the older kids. Maybe they're upset because they can't go to their friend's house and spend the night because it's something that is really affecting them. But the reason that an underdeveloped airway is related to bedwetting is simple. If we're not getting proper oxygenation, like I mentioned before, it increases the heart rate and the blood pressure, which then causes your kidneys to have to filter more. If your kidneys are filtering more, your bladder is going to fill and there's going to be the need to go to the bathroom. Children wet the bed. Parents and adults, we wake up and go to the bathroom. So here's an article taking a look at bedwetting and the use again of our guide appliances, looking at children 5 to 12. And what it showed was that among the patients, 97.3 showed a decrease in their bedwetting. But what's really amazing to me is that 54% of those kids had their symptoms resolved within 2 weeks. It's pretty amazing. Alright, so clenching and grinding. Another common but not normal thing. We see this in both kids and adults. If you clench or grind your teeth, you have an airway problem. Okay, let's take a look at what Dr. Bemoralia has to say about this.
Nose breathing is so important to human beings that the body has a protective mechanism to make sure that it keeps it going nicely for you. So obviously a lack of oxygen would be very bad for a human being, and we don't get a whole lot of time without oxygen, maybe about 3 minutes or 180 seconds. So your body built a mechanism through the nose. The body has a mechanism to help the air get through better. And that mechanism happens to be in the clenching and grinding of the teeth. So the pathway over which that works is that when the nose doesn't get the air in very well, the mouth will open to allow some air to get in there. But that doesn't usually improve how well we are oxygenated and how the exchange of the gases is occurring. So what the body then does to try to improve the breathing is it snaps the jaw shut, and then they grind around a little bit. So now clenching and grinding is really the body trying to reposition the jaws, which means reposition the tongue. If the body clenches and grinds enough that the lower jaw moves enough and the tongue moves enough, the air will get by better. If the air gets by the tongue better, the body is happy about that, so it stops the process. So basically we go through cycles at night of mouth closed with nose breathing, then mouth open with mouth breathing and nose breathing mixture, but then clenching and grinding as the body recognizes it doesn't like how the air is flowing, it wants to reposition the tongue. It is an airway protective mechanism, so clenching and grinding is unhealthy. At any age, it is not something that is normal or we would ever outgrow. A child who is clenching or grinding their teeth has an airway or breathing issue.
Okay, so what can we possibly do? Why are you sitting in a dental office learning about how to breathe better at night? We offer several treatment options for our patients. We offer our guide appliances, which are our preventative options for kids as young as 3 and up to 12 years old. The amazing thing is that it is cleared by the FDA as an effective treatment for airway and developmental issues. We also can help adults manage their symptoms. So what can we do for our kids? I'm going to show you a case study of what we can do if we intervene at the proper time. So take a look at this little girl. We've had some pretty amazing results here. The really remarkable thing is that the differences that you're seeing in the child on the left and the child on the right happened in less than a year. I'd like you to pay attention mostly to these photos down on the bottom in the center here. You can see when this child started, she had quite a bit of an overjet. Her front teeth were very prominent, sticking out way far past her lower jaw. After only about 9 months of treatment with our guide appliance, you can see that that space has closed. It's pretty amazing. So for all of our patients, we want to promote proper nasal breathing. It's a huge component of what we do. So tongue up in the palate, lips closed, and nasal breathing. If we can achieve that, we can achieve proper space for the tongue and perfectly aligned teeth and healthy airway. So remember that photo of the Gothic arch. That's not ideal. We want more space for the tongue to live up and forward, and of course, we want to eliminate bad habits like thumb sucking, prolonged use of pacifiers, tongue thrusting, and improper swallow. So what can we do with adults? We support airway health in our adults using clear aligners to help widen their arches and offer myofunctional therapy to strengthen muscles and promote proper function. There are studies that have shown that myofunctional therapy alone can reduce sleep apnea in adults by 50%, just by strengthening the tongue and getting it in its proper position. And by the way, it can reduce sleep apnea in children by 62%. So here's our preventative options. These are our guide appliances. And they have some really cool features here. But what I love about them the most is that it's non-invasive, it's non-pharmaceutical. This is a solution for your kid when you've exhausted other solutions or you're really looking for that root cause. So on the top here, we have our starter appliances. And what's amazing about them is they've created this really wide bumper to fit into the lips and the cheeks. If we have improper function, those muscles are very tight and it holds back growth. It actually puts negative pressure onto the teeth to prevent the growth. We also have a tab that sits up into the roof of the mouth where the tongue is supposed to sit. We call this spot. That's where the tongue should live. These appliances actually are built in a way that guides the tongue up and forward. There also is something built into these appliances that will help to apply gentle pressure outward to start expanding the arches. And as our kids get older, we move them through a series of appliances. Our older kids will also be doing some daytime wear and some exercises with them as well, but the starters are just worn at nighttime. Okay, so other treatment options. We offer myofunctional therapy. We screen all of our patients for tongue and lip ties and refer out for releases for those as needed. We offer our clear aligner therapy, which is airway focused. And for our really narrow kiddos who need a little bit of extra, we do some fixed expansion appliances for them as well. We're always focused on whole body wellness here for all of our patients, so we do take an integrative approach. If there's something beyond what we can do for our kids here, we refer out to other care team providers. So how do you get started? We get your child scheduled for a screening and consultation visit where we'll take some measurements, assess function, and talk about what your goals are for your kid.
Does this help with speech?
It can. Yeah. And so, based on those functions, the functional assessment, we create a customized treatment plan so that your child and you can achieve those goals. And then it's as easy as getting started. We hand you a guide, we show you some exercises, and then we meet periodically to make sure things are progressing. So if you're interested in finding out if these appliances are right for you, Arthur can help you with scheduling. Right. Does anybody have any questions? As far as speech goes, so we're
Somebody
not,
asked that question.
Oh, perfect. I'm glad. We're not speech language pathologists, obviously. If a child is really struggling with speech, we definitely want them to have evaluated there. But yes, if the tongue is not in the right position, then if it's laying low in the floor of the mouth, then some sounds can be challenging for kids. Oftentimes tongue ties or lip ties can, prevent proper speech sounds as well. So yeah, it's all linked.
Do you know how long it takes for it to sort of correct?
For speech specifically?
No, just in general for
So, so like with that case study, we were seeing changes for that kid in just 9 months. But I know some of the other kids that I've been treating, in as little as 3 to 6 months, we've seen some changes. It's not always dramatic and apparent to everyone, but I've had some parents tell me their kids are sleeping better, breathing better, their behavior is better. Any other questions?
Does it live live here? She can come back and look a little job about he doesn't come back. How you can contact her Siri to get yourself scheduled.
No.
Thank you, everyone.
It's a good information. That's all. No question. Okay.
Thank you.
Good information. Very good.
Alright, awesome.
So,
That's all right.
can we okay.
Porque sé que habíamos hablado con su esposa
Say something good, AS, or say something, and then we can stop the live. Let's say something, we can stop the live. It's still on. So say bye-bye.
Thank you so much
For tuning us.
guys.
Yes.
I know that's great. If you have any questions or if you would like to schedule a consultation, please call us at 301-515-0030. Thank you. Take care.